If it feels like the room is spinning and you didn't just get off the teacups at Disneyland, you may have BPPV, or benign proximal positional vertigo. Hi, Dr. Malka here, your chiropractor and acupuncturist from Los Angeles, California. And please make sure you go to your medical doctor before you do these exercises and rule out other conditions, because it may be an underlying condition that's much worse. I'm going to show you some exercises to help you with your vertigo. And I know this sounds a little bit obvious, but do make sure you're drinking enough water, because one of the biggest reasons for dizziness is dehydration, and make sure you're getting your vitamins. With these exercises, I'm going to do the ones that are the most simple to the ones that have more movement. So if your vertigo is really bad, you'll probably want to just stop at those first two exercises. And then if your vertigo is not so bad and the first few seem like they're simple, then go ahead and ramp it up to the more complex exercises where you're going to be moving your head. But the first ones I'm going to do don't require any head movement, so therefore you won't get overly dizzy or nauseous. And also make sure you're in a very stable area in case you fall, you won't hurt yourself. So let's first start by pulling down the ears, and you're going to swallow and hold that for 30 seconds. Some of the vertigo can be due to the eustachian tube getting blocked up, and this can help open it up. Again, pull pretty aggressively on the earlobes and then swallow. The next are going to be eye movements. I want you to go ahead and move your eyes all the way up, all the way down. Bring them to one side and to the other. And then you're going to be bringing your eyes up diagonally and then down in the other direction, and then up diagonally and then down. And then just relax for about 30 seconds. If you got a little bit of dizziness with that exercise, just repeat that one and don't continue on. But if you felt good with those, let's go ahead and ramp it up a little bit. So I'm going to bring my finger out and bring it all the way to the nose. And you can see my eyes are crossing, right? So bring the finger out, and then you're going to bring the finger out to the side and follow it. And then to the other side. Now this is very similar to that first exercise. Actually, it's exact. But with focusing on an object, it does increase the precision of the exercise that you're doing, because you're having to follow this object. And it really helps with tracking of the eyes and controlling it. I'm going up into the diagonal and making an X all the way down to the other side. And then the other diagonal. And then down. And once again, if you got dizziness with this exercise, just keep repeating this one. If not, let's keep moving on. This time we're going to bring the finger here, but this time we're going to track it with our head, turning the head in one direction, turning the head in the other direction. If you feel dizzy, just hold it for about 30 seconds, wherever you're at, until the dizziness goes away. Come back to center. We're going to bring the head up, and then bring the head down. And then we're going to make that X again, working in that diagonal. Diagonal up, diagonal down. So try to keep your eyes in the forward direction, because you really just want to move your head in the direction of your finger, and then down. And then the final exercise, and this one you want to do, if you went through all of these and you're not having dizziness, or you can even try this one even if you have a lot of dizziness, but just be careful. So what you want to do is drop over to your side and then look up at a 45-degree angle, And you're going to hold this for 30 seconds. And go ahead and come on up. Make sure you use your arms to push you up. Now, if you're really dizzy, just hold this. And now we're going to go to the other side. Dropping down to the side and then turning your head up 45 degrees. And hold this for 30 seconds. And then come up and then sit for 30 seconds. This one can be done about 5 times, 2 times a day. All these exercises can just be repeated over and over. Anyway, so if you feel like you're a little less dizzy, go ahead and subscribe, like, and share with your friends. We will be launching a new YouTube video every Wednesday and Friday at 3 p.m. and I'll be available for any questions you have or suggestions for future videos.